symptoms of low thyroid or hypothyroidism, and the labs you need to look at or ask for. So, a holistic approach to diagnosing hypothyroidism or low thyroid. So, first, medical history. Okay. Second, these are 6+ thyroid lab tests you need to do. I'll go over them in a minute. Basal body temperature. So, this is your temperature while in bed in the morning. And then, obviously, the physical exam. So, there are the thyroid lab tests that I mentioned. TSH, which is the thyroid stimulating hormone. They usually do this one, so this is familiar to you already. Free T4, that's the second one you see them do. Free T3, so you don't see them do this one. You want to ask for this. Reverse T3, that's another one, not done, but ask for it. And thyroid antibodies, this TPO and the thyroglobulin antibody. Those two are important, especially when you want to rule out Hashimoto's, which is an autoimmune condition of the thyroid. The desired level. So this is the big pet peeve, and this is where patients get concerned. They told me my thyroid was normal. And when we look at the levels, I can see why the patient is tired or symptomatic and not treated. So traditionally, they allow your TSH to go not even 0.4. Usually they'll allow it from a 1 to like 5.5. I've seen that before, and the patient is not treated. You want your TSH, honestly, to be 0.5 to 2. If you're elderly, 0.5 to 2.5 micrometers per ml. Now, I will even do a 1 to a 2.5, but nothing more than that. Okay. Free T4. So, not often discussed or looked at. Usually, they'll let you roll around between 9 to 23. You want to tighten that up between 15 to 23, okay? Parts per mole milliliter. Free T3, this is a common one, especially people who are complaining of being overweight and tired. You will find this level at, I have seen it at 2.5 untreated, 2.1 untreated. You technically really want it between 5 to 7. Some people may feel that may be too high. I would never let it go below 4. There you go. I want it at least at 4. So that's your free T3. Reverse T3. Okay, I have seen this elevated, like in the 22, 23 to 25, when a patient has a lot of inflammation or has recently had an illness. The normal range is 11 to 18 nanograms per DL. But if it's anything, honestly, over 20, I start looking to see if there's gut inflammation. And we try and get on a take off gluten from the diet, maybe even dairy from the diet, probiotics, L-glutamine, and try and heal the gut lining first, because that's usually where most commonly people have inflammation, especially in the West, even more importantly in the United States. Thyroid antibodies, TPO. Again, it's a sign of autoimmune condition. You really don't want to see anything less than 2. Some people let it go a little too high, up to 35. To me, any sign of autoimmune inflammation, start making sure that, again, the gut, there's no inflammation in the gut. Take off the gluten or any inflammatory foods, or any too many processed foods affect the gut lining. I would start there. It's not the only cause, but often that's the case. The same thing with the thyroglobulin antibodies, okay? You just kind of don't want any of them. Some people will allow you to get to 35. You just don't want them, okay? All right. What are the common symptoms of low thyroid? This is kind of where the patients know something's off, but they can't put their finger on it. From observation, you'll notice the outer part of the eyebrows is thinned out without them having to pluck them, okay? Also, dry, coarse hair. They're like, my hair is so dry. They're putting all these moisturizers on them and lotions and sprays on there, and the hair is dry from the root up. Constipation, so they struggle with when they go to the bathroom, pretty common. The next one, cold intolerance. This is pretty common. The hands are cold all the time. It's warm, but they're cold. They're wearing a sweater all the time. That may be a thyroid issue. Chronic fatigue. They're just kind of tired. They wake up tired. In the afternoon, they're tired again, falling asleep on the desk at work. Heavy menstrual cycles. In women, you will see this sign as well. Dry skin, again, not just during the winter, even in the summer, the skin is still dry. Brittle nails, and this is a sad one for me, brain fog, depression, and anxiety. One or all three. all because of thyroid. So before you run into depression or anxiety diagnosis, make sure your thyroid is in the right range. So what do we do to treat low thyroid? Commonly, and everybody knows this, levothyroxine, okay? The common, also called Synthroid. Most people get, when they are diagnosed with low thyroid, they will get the prescription levothyroxine. In some cases, when the provider has dug a little more, especially the free T3 level, they will also put you on liothyronine. And a lot of patients feel the fatigue lift when we do this. Anybody even on weight loss medication, really look at that free T3 and maybe treat them with liothyronine, also called Cytomel, because it does help. If it's below 4, you may want to treat that. For me, my favorite combination is the T3-T4 combination. It comes maybe as NP thyroid or Armour thyroid, or just compounded at the compounding pharmacy. This is the combination of both T3-T4, which is also a combination of what you call levothyroxine liothyronine. And I will explain on the next slide why you really want to do this. Okay, the poor T4 to T3 converters. This is a very common misdiagnosis. So a lot of times patients will come and say, they said my thyroid was okay. And I'm like, really? What did they check? T4 and TSH. Is that all? So when we go check the free T3, it's low. Probably we check the thyroid antibodies and they're present. So, but for the purposes of this slide, T4 to T3, T4 to T3 conversion is not happening. And why is it not happening? And this is really common. First is nutrition deficiencies. A lot of them, the iodine is low because you don't find iodine in food really. So you have to intentionally either take in a supplement or seaweed snacks and things like that. Selenium is low, copper, chromium. So basically, this is mineral deficiencies. So if you're not taking a mineral complex on a regular basis that has iodine in it, you're probably deficient. Medications that cause poor T4 to T3 conversion. Estrogen. So women that are on hormone replacement therapy on estrogen creams or patches, this will happen. So a lot of times we will treat for the hormone replacement therapy for menopause or whatever, and then check the thyroid levels once the patient's dosing is stabilized and see what their TSH, their free T4, and their free T3 is doing. And if it's not converting, you may want to put them on something. Birth control pills. We have girls all the way from 16 on birth control pills, and they're not converting well. So pay attention to that. At least, even if you're not going to treat it, just make sure their iodine and selenium is on point. Patients on steroids, beta blockers, which is a blood pressure or cardiac medication that's pretty common. So very common medications can cause this. Now, the others that just happen is aging, you're going to get older and you just don't convert well. Alcohol intake, diabetes, heavy metals like mercury, which can come from your tooth fillings, fluoride, which you find in your toothpaste, because it's on group 7 on the periodic table, fluoride and iodine. So fluoride can compete on the iodine receptor, so you got to pay attention to that. Obesity, pesticides found in your food or water, stress, just the stress of living, and surgery, the stress on recovery from the surgery, and also foods like soy, which are usually estrogen rich, right? Okay, so what do we do? Here's your shoebox. What can you do for your thyroid? Or if you suspect something's off, check your basal body temperature. So in the morning before you get out of bed, put on a thermometer and see if your temperature is not regularly between 97.8 Fahrenheit to 98.2. Pay attention. This is while still in bed. Obviously 36.5 to 36.7 Celsius, okay? Hashimoto's thyroiditis, pay attention to that. If you're autoimmune, the TPOs and the thyroid antibodies I talked about, if they're elevated, pay attention to that. Reduce your gluten intake, which is obviously from your bread and pasta. Pay attention to that. Inhale your stomach lining first. Elevated reverse T3, again, gut inflammation like I mentioned earlier. Pay attention to processed food and clean up your diet and take off the gluten. Now, this is important. If you are pregnant or planning to get pregnant, please make sure your TSH is at least 1. Why? If it's higher than that, pointing at any some form of low thyroid or subclinical hypothyroidism, it affects your baby's IQ. Okay, so that's important, very important. More shoe boxes. Did you know that if your TSH levels are above 4.5 to 6.9, you have a 9% chance to increase your coronary heart disease? And if it's over 10, you have a 58% chance increase in your coronary heart disease. Imagine that, okay? Let's talk about another shoebox. What is this? Just things to think about. Iodine. You can get iodine supplement at 12.5 grams. You can take 1 to 2 tabs a day. Obviously, check the levels and make sure you're not overdoing it. And another thing, when you go to the doctor, make sure they palpate your thyroid. It's right there at your neck. They can do that. If they feel something, some form of enlargement or a nodule, always ask to get a thyroid ultrasound, okay? Okay, guys, that's it on thyroid. Again, this is not by any means exhaustive. This is just low thyroid and maybe Hashimoto's. These other conditions like Graves' disease, now you need to, those are extra labs that need to be done, and maybe an endocrinologist can help you with that. Thank you and have a wonderful rest of the day. See you on the next one.